mean, we've been talking about outbreaks across the Sun Belt. You're warning now about a resurgence in states across the Midwest. In recent days, you've named 20, we're putting them up on the screen, 20 of the 50 states as places you're watching. So are we in a new phase of the pandemic? And if so, what are you going to do to change course?
I think those are two very critical questions because we are in a new phase, and that's why I really wanted to make it clear to the American people. It's why we started putting out governor reports directly to the health officials and the governors in every single state, because we could see that each thing had to be tailored. So each state has a tailored set of recommendations based on what we're seeing at the community level, what we're seeing relevant to the hospitals, and each of these responses have to be dramatically tailored. We are beginning to see an impact from the mitigation procedures that many of the state and local officials have put into place. But I want to be very clear, what we're seeing today is different from March and April. It is extraordinarily widespread. It's into the rural as equal urban areas. And to everybody who lives in a rural area, you are not immune or protected from this virus. And that's why we keep saying, no matter where you live in America, you need to wear a mask and socially distance, do the personal hygiene pieces. But more importantly, if you're in multi-generational households and there's an outbreak in your rural area or in your city, you need to really consider wearing a mask at home, assuming that you're positive if you have individuals in your households with comorbidities. This epidemic right now is different, and it's more widespread, and it's both rural and urban.
Dr. Birx, before we move on to some specifics, I just want to really try to get a handle on this, because what I'm trying to express to you, which is something that I know that you're hearing, people are panicked. People are worried. People don't understand why this is seeming to be completely out of control. Johns Hopkins University said, quote, this week, the United States is not currently on course to get control of the epidemic. It's time to reset. A couple of other medical agencies, associations said similar. So is it time for the federal government to reset?
Well, I think the federal government reset about 5 to 6 weeks ago when we saw this starting to happen across the South. And that's why we've done these rather than generic federal framework, we've gone to very specific state and local, city by city, county by county, showing out which counties and which cities are under particular threat and what mitigation has to be done.